Good morning, everyone. Welcome to today's webinar. We are thrilled to be kicking off our series of 3 webinars today. My name is Marie Latulippe, and I'm the Director of Science Programs at the Institute for the Advancement of Food and Nutrition Sciences, or IAFNS. In this 3-part webinar series, it's really well suited to anyone who's interested in learning more about consumers and how they interact with nutrition and food safety information and how that research is conducted. So this first webinar will focus on the food label and how that information might impact consumer behavior. And as we start, just to make sure you're aware of IAFNS, the organization bringing you this webinar today. We are a nonprofit organization that advances food and nutrition science for public benefit. And the way we do that is we bring together scientists from different sectors. So scientists from government, industry, and academia come together. They decide on their research questions of common interest, and then we develop programs and projects around those interests. And some of the things that IAFNS delivers includes competitively funded research. We also organize workshops and dialogues to address some of these questions, and we always aim to produce a peer-reviewed publication from this work. Hopefully you can see that we're on Zoom today, and this is becoming familiar to everyone, but essentially you can type your question into that Q&A box at the bottom of your screen, bottom of your panel, and we will take those questions at the end of the presentations. Those questions are only going to be visible on our side, not to the entire audience. So with that, we are pleased to introduce our opener today, Dr. Brian Southwell. He is a distinguished fellow at RTI International, where he oversees research to assess risk perceptions, mental models of scientific concepts, and public trust in science and scientists. Dr. Southwell is also an adjunct professor of internal medicine at Duke University, and he's an adjunct associate professor with UNC Chapel Hill School of Public Health, and an adjunct faculty member with the University of Delaware. Dr. Southwell has also served on several National Academies of Sciences, Engineering, and Medicine committees, including the Standing Committee for Advancing Science Communication. So Dr. Southwell is going to kick off the series today with some comments about the work of RTI, and he will then take us into our next 2 speakers, Cheryl Cates and Dr. Dallas Wood. So we'll turn it over to you, Dr. Southwell.
Great, thanks so much, Marie. I really appreciate the opportunity. Dallas, you can go ahead and switch over to our slides that we'll share with you here. This is a wonderful opportunity for RTI, to collaborate with IAFNS, and we really appreciate the partnership. RTI International is an independent nonprofit research institute that has been doing work to improve the human condition for a long time now, and for the last few decades, we have been doing a fair amount of work in partnership with clients to figure out the best ways to optimize information for health and wellness. And I'll talk to you in a little while about the larger series that this webinar is a part of. But today we get a chance to put a spotlight on 2 of my colleagues at RTI who have been doing this work for decades now. And it really is an honor to have them both here with us today. Sherry Cates is a senior research scientist at RTI International, and she has been doing work here for more than 30 years, conducting consumer behavior research. She's in health communication research and program evaluation. She's worked with a variety of clients, including the Food and Drug Administration, the U.S. Department of Agriculture, Food Safety and Inspection Service, and a variety of other partners. And her research is focused on consumer knowledge, perceptions, behaviors regarding food safety, enhancing consumer nutrition education, and consumer response and understanding of food labels. We also have a chance to hear today from Dallas Wood. Dallas is assistant professor of economics at Western Carolina University, and he's also senior economist at RTI International. He's got more than 15 years of experience conducting survey research on multiple topics. In particular, he's conducted a lot of work on discrete choice experiment studies, investigating how consumers make food and health choices for clients such as FDA and USDA. And as I'll disclose on the next slide, here, this work today is the direct result of funding from FDA and USDA in different circumstances. And we really appreciate the chance to bring that to you. As I'd mentioned a minute ago, this webinar today is part of a three-part series. And so as I'll mention on the next slide, we do want to welcome you and invite you to those other webinars we have upcoming. And this is going to be an opportunity to hear more about this work. And a lot of these webinars are related. I'm going to actually put in the chat here a place where you can go to register for the additional upcoming webinars. Today, we're going to hear specifically about measurement and innovations over time that we've looked at in ways that we assess and measure perception and behavior, which can be a complicated task. We also are going to have an opportunity to look in a very specific way at responses to risk and benefit information. I'm in a webinar that we'll hear from colleagues on October 14th around the same time, a little bit later or earlier in the afternoon. And then we have a third webinar in which copes and deals with the fact that consumers cope with really a complicated information environment in many circumstances. And so our third webinar, Helping Consumers Navigate Complex and Conflicting Information Environments, will be held on October 28th at noon Eastern Time. So with that, I'm going to turn the floor over to Sherry Cates, and she's going to walk you through a series of studies. And Sherry, the floor is yours.
Great. Thank you so much, Brian. Glad to be here today. So according to a recent NSF survey of 1,000 U.S. adult consumers, 83% of consumers read food labels before making purchase decisions, and nearly 2/3 pay more attention to food labels now than they did 5 years ago. When reading food labels, consumers look for a variety of information, including ingredient lists, health claims, allergen warnings, and country of origin labeling. The amount of information on food labels can be overwhelming and potentially confusing to consumers. The same survey found that only 16% of adults find health claims that appear on some food products to be trustworthy. Many shoppers lack the nutritional knowledge and time to understand and decipher food labels, potentially exposing them to misleading health claims. Easy to interpret food labeling can help consumers make educated decisions related to health and diet and their well-being. As shown on the next slide, it is understanding how consumers use and interpret information on food labels can be challenging. Researchers often rely on consumer surveys to collect information on consumers' knowledge, attitudes, and practices, and in particular, how they use information on food labels to inform purchase decisions. However, surveys are limited in their ability to predict behavior because they primarily capture consumers' reported thoughts and attitudes, which, as we know, may not align with their actual behavior. This gap between stated intentions and observed behavior may be influenced by different types of biases, as well as the oversimplified nature of survey questions, which can fail to capture the complexity of real-world decision-making. So as we'll talk about on the next slide, rather than relying on stated intentions, indirect methods focus on observing what consumers actually do in real-world settings or simulated scenarios, thus providing a more truthful reflection of their response to labeling information. Direct questions can sometimes lead consumers to provide socially desirable answers or answers that they believe that the researchers want to hear. Using indirect methods can minimize this bias by not directly asking consumers about their response to information on food labels. There's a variety of indirect methods, which include observational research, which can be relatively inexpensive through participant observation or tracking in-store behavior, data mining and analytics, as well as projective techniques that use indirect questions, and also technologies such as eye tracking to measure consumer response. Additionally, using an experimental approach where respondents are randomly assigned to one of a set of labels, including the current label or control, allows the researcher to control variables of interest to establish causality as well as to minimize the influence of extraneous or compounding variables, leading to clear and more reliable results. While direct methods such as surveys are still useful, especially for detailed insights to consumers' knowledge, attitudes, and practices, combining them with indirect approaches often provides a more comprehensive understanding of consumer behavior. In today's webinar, we're going to provide 3 case studies providing examples of indirect methods used by RTI in studies for either USDA or FDA. The first is a limited time exposure experiment, which we use to measure noticeability of a food safety label. I'll then pass it over to Dr. Dallas Wood to talk about 2 discrete choice experiments conducted by RTI. The first to assess willingness to pay for a voluntary Product of USA labeling claim, and the second a discrete choice experiment to assess the likelihood of product choice and health perceptions for food fortification claims on snack foods. So taking a look at the first case study, as shown on the next slide. So first, a bit of background. Since 1994, the USDA has required that all raw meat and poultry products have what's called the Safe Handling Instructions label. This label provides information for consumers on how to safely handle and prepare raw meat and poultry products, such as washing hands, cleaning surfaces, and cooking foods to proper temperatures. In response to inquiries from consumer groups and other stakeholders about potential changes to the safe handling instructions requirements, including adding more detailed information on thermometer use, USDA's Food Safety and Inspection Service contracted with RTI to create and evaluate potential new designs for a safe handling instructions label. Now, the study looked at a variety of different outcomes, but today we're going to focus on which new label design best attracts consumers' attention relative to the current safe handling instructions label. So to talk about the approach that we use, as shown on the next slide, for a food safety label to be effective, consumers must first notice the label, then read it, then comprehend it. It's also important that the label motivate consumers to follow the recommended safety instructions. As I noted, while this study considered all of these different outcomes, today we're going to focus on noticeability or attention. We used methods from signal detection theory to measure saliency, that is, the ability of a stimuli to attract attention in a complex field. Signal detection is a branch of psychophysiology that examines the ability of a respondent to discriminate visual or auditory stimuli that contain information, known as the signal, from stimuli that do not contain information, the noise. So similar to the task that a consumer faces when looking at a food package that contains a variety of information on the package. Using a limited time exposure approach, individuals are exposed to a stimuli for a limited amount of time and then asked to recall whether specific items were present or not. As noted, using an experimental design with random assignment to study conditions, the current label or alternative version provides an unbiased assessment of whether any of the potential new label designs is significantly better at attracting respondents' attention. So for this study, as shown on the next slide, we exposed respondents to 1 of 10 randomly assigned mock ground beef packages. So the package is shown here at the bottom of this slide, and we tested 9 different alternatives to the safe handling instructions label, as well as the current label, which served as the control. The test labels varied in terms of the label shape, so octagon or rectangular, as well as the format. We also varied what's called the alert word, which is the word at the top of the label, attention, important, caution, which is designed to attract consumers' attention. We also varied the title of the label, such as food safety steps or avoid illness. We also looked at different links for the instructions themselves, a shorter, concise version versus a longer version, which contained more detailed information. So respondents were randomly assigned to see one of the 10 raw ground beef packages. They were exposed to the package for 20 seconds, and prior to that, they were told to examine the next screen carefully because they would be asked some follow-up questions. So the task at hand were, there were two different tasks that respondents were completed. First was unaided recall, in which respondents were asked to write down everything they recalled seeing on the food package, any words, images, or so forth. The next task is what we called a cued recognition task, and this included 8 dichotomous questions. 4 of these questions asked about elements that were on the SHI label on the package, and we refer these as hits. So the alert word and title, which varied across the 9 test conditions and the current label, and then the hand washing icon and thermometer icon, which were the same for the test labels, but different for the control label. And so these were referred to as hits. And then the false alarms asked about words or images that were not on the package. So prior to completing this task, respondents completed a practice question for a raw chicken tenders product. So as shown on the next slide, respondents were randomly assigned to one of the 10 label conditions. We had 2,400 participants in this study, U.S. adults who had prepared a meal using raw meat or poultry within the past 30 days. And so with 2,400 participants and 10 label conditions, we had 240 participants assigned to each condition. So taking a look at the results on the next slide. First, the unaided recall results. So for the open-ended responses to the unaided recall question, we coded the responses as respondents either recalled seeing the label on the package or they did not. So respondents were coded as having recalled seeing the label if they mentioned seeing any of the different icons, the alert word, the title, or any just general mention of food safety instructions or safety labels or things like that. And if respondents did not mention anything pertaining to the label, then they were coded as having not seen the label. So we then estimated the proportion of participants who recalled seeing the safe handling instructions label. So as shown here, the percentage of people assigned to the treatment conditions that recalled seeing the SHI label ranged from 15% to 33%, whereas only 14% of the respondents recalled seeing the current SHI label. And based on the results of the statistical testing, labels 1, 3, 4, 7, and 8 performed better relative to the current safe handling instructions compared to the control label. And so 2 of those labels are shown here, labels 7 and 8. In the next slide, we can see the results for the cued recognition. So as I noted, respondents were asked 4 questions about items that were on the label referred to as hits, and then items that were not on the label referred to as false alarms. And so using the responses to these questions, we then calculated what's called the D-score, and the formula is shown there. And so this results in a D-score ranging from -4 to +4, and the condition with the highest D-score has the highest noticeability. So the results are shown here with the control shown in the green bar. So the D-score ranged from a high of 1.03 for treatment 3 label to 0.81 for treatment 5 label. And based on the results of the statistical testing, none of the test labels performed better relative to the current SHI label. So FSIS can use the results of this study to help inform potential changes to the safe handling instructions label. So based on the results for the limited time exposure experiment, as well as the questions we asked to assess other outcomes, two of the labels, labels 7 and 8, shown previously, appeared to do a better job at motivating consumers and increasing awareness of the safe handling instructions label. Okay, so I'm now going to turn it over to Dallas Wood to share the results from the other two studies that we're going to talk about today.
Awesome. Thanks, Sherry. So like Sherry said, we're going to move on and look at some of our other case studies. So in particular, we're going to look at first a discrete choice experiment that we did to assess how willing consumers are to pay for products with particular labeling claims. So in particular, in this case study, we're going to be looking at an analysis that we did for USDA, where we were analyzing how much consumers value the product of USA labeling claim. Okay, so just to give you a bit of background on that study. So at the time of our study, a beef product could be labeled a product of USA so long as it was processed in the United States. And so that means you could have a beef product that was made from cows that were born, raised, and slaughtered in another country, but so long as the meat product itself was processed in the US, producers could use a product of USA label, right? And so our study was initiated by USDA because they received a number of complaints and petitions suggesting that this use of the product of USA labeling claim was maybe not accurately reflecting how consumers understand the term. Okay. And so basically, USDA conducted a comprehensive review of how these labeling claims are used as part of their rulemaking process to reconsider how the product of USA label should be defined. And so as part of that review, they commissioned RTI to conduct a series of consumer research. And as part of that research, we looked at a number of different research questions. But the research question that we're going to focus on for this presentation is basically we were looking at, is the average US consumer willing to pay a premium for beef products bearing a voluntary product of USA labeling claim? So how do we answer that question? How do we find out if consumers are willing to pay more for a product with a label that says that it's a product of the USA? Well, the way we did that was we basically conducted a survey. And so in particular, what we did was we conducted a survey of over 1,000 US adults using the Ipsos Knowledge Panel. All right. And in particular, we focused on adults that were responsible for doing the grocery shopping in their household and had also purchased a beef product in the past 6 months. Okay. And so as part of that survey, we included what's called a discrete choice experiment. So in particular, survey respondents were randomly assigned to either a ground beef discrete choice experiment or a steak discrete choice experiment, where they were asked to answer a series of 10 choice questions. So what's a discrete choice experiment? Well, basically, a discrete choice experiment is just a stated preference survey method that uses choice questions to quantify individuals' preferences for different products. Okay. And so in a choice question, basically, we ask the respondent to choose between two or more hypothetical goods that differ based off of some characteristics or what we call attributes. Okay. And then we use the data that we collect from asking those choice questions to estimate a statistical model that, in this case, allows us to estimate how much consumers are willing to pay for product characteristics, like whether the product has a product of USA label on it. Or we could also use this data to estimate how likely consumers are to choose one product over another. And we'll look at that in our next case study. All right. So in this particular case study, we asked respondents, like I said, a series of 10 choice questions. And here's an example of one. So this is an example of a choice question from one of the ground beef discrete choice experiments. And so as you can see, the respondent was basically asked to choose between two hypothetical ground beef products. And these ground beef products differed based off of, in particular, price, whether they had a Product of USA label, and then whether they also included other labels, such as whether they were free from antibiotics or whether the beef was grass-fed. Okay, and so basically the consumer, or the respondent rather, would look at these choices, and based off of these product characteristics, they would decide which product would they actually want to buy. Would they want to buy product A or product B? Okay. And so in terms of how these characteristics differed, here's a summary of our experimental design. And so this sort of just shows all of the what are called levels, or basically just the ways that each attribute can vary. So you can see that price ranged from 380 for beef products, ranged from 389 to 569. And the labels basically just varied in the sense that they were either present or not present. Okay. All right. So after respondents completed a series of these questions, we could use the data that we collected to estimate a logistic regression model that captures the likelihood that respondents would choose one meat product over another. Okay. And this is known as a random utility model. And you can use the coefficients from this random utility model to basically infer the price premium that consumers would be willing to pay for a meat product that featured a Product of USA labeling claim. And so that's what we did. So here's our results. So as you can see, we have the price premium. For each of the two discrete choice experiments that we conducted, we have the price premium for ground beef here, which was $1.69, and the price premium here for steak, which was $3.12. And so basically what we found was that if the question was as simply, are consumers willing to pay more for beef products that feature a Product of USA labeling claim, then the answer is yes. So specifically, consumers are willing to pay $1.69 more per pound for beef products that feature a Product of USA labeling claim. And they're willing to pay $3.12 more per pound for New York strip steaks that feature a Product of USA labeling claim. And so this just illustrates that the Product of USA labeling claim is important to consumers, and they are willing to pay a premium for products that feature that claim. And so this information, along with other data that we collected, was used by USDA to further their rulemaking process and to basically say, like, okay, yes, consumers are willing to pay more for products that feature this labeling claim. So defining it correctly seems important. And other parts of our research help them decide how best to define that labeling claim. All right. So that was our first case study. So in our next case study, oh, almost forgot. It's important to talk through some limitations with discrete choice experiments like this before we do move on. So in particular, first, it's important to note, as you guys probably noticed, as I was stepping through the hypothetical or the example choice question, it's important to note that these are hypothetical choices that people are making, right? So in the discrete choice experiment, they're choosing between one hypothetical product versus another, right? And that's why this is called a stated preference method, right? Because it's basically just based off of what people said that they would buy. So potentially, this method could suffer from hypothetical bias, just like any other survey method would, right? But one thing that kind of distinguishes this method from, say, contingent valuation methods, where you might have like an open-ended contingent valuation question where you just ask people, like, well, are you willing to pay more for ground beef that features this labeling claim? And if so, how much? the advantage of using hypothetical choice questions is it kind of matches shopping scenarios that consumers engage in every day. And so as a result, people are less likely to be confused or act in bizarre ways whenever it comes to making choices, and this helps mitigate the problem of hypothetical bias. And so a number of different studies have been conducted in the past looking at the potential for hypothetical bias in discrete choice experiments. And at least for estimating marginal willingness to pays, like improvements in product characteristics, like for example, whether it features a product characteristic like including a label or not, previous studies seem to have found that there was minimal hypothetical bias whenever we estimate willingness to pays for these sorts of product characteristics. And so anyways, all of that is just to say that, you always have to be mindful of hypothetical bias because this is a stated preference survey method. But at the same time, this is a survey method that at least tries to minimize these problems. Okay. So now we can move on to the next case study. So in this case study, we're still looking at discrete choice experiments, but now we're going to be using a discrete choice experiment to assess how labeling claims can influence both the likelihood that consumers choose a product and the likelihood that consumers view the product as being healthy or not. Okay? So in particular, for this case study, I want to talk through a discrete choice experiment that we conducted for FDA on the impact that nutrient content claims would have on the likelihood of product choice and the likelihood of health perceptions. So just to give you a little bit of background on this. So as you may or may not know, the FDA discourages food manufacturers from fortifying snack foods. So, for example, they would discourage, if you were a brownie producer, they would discourage you from including vitamin D, fortifying your product with vitamin D, just as a way to attract customers, right? But that doesn't necessarily mean that manufacturers don't sometimes add vitamins and minerals to their foods. And so this raised the question with FDA of like, well, if snack food manufacturers do decide to include these vitamins and minerals in their foods, how does this affect the choices and the perceptions of consumers? So we had 3 specific research questions that we wanted to answer as part of this study. So in particular, we wanted to look at, do fortification labeling claims on snack foods affect the following 3 things? So first, do they affect the consumer's decision to look for nutritional information or not? So whenever they're purchasing a product, does including a fortification labeling claim influence whether the consumer looks at the nutrition facts panel or doesn't? So that's our first research question. Our second research question was, does including these sorts of labeling claims influence the consumer's decision to buy the product or not? And then third, we wanted to know, does the presence of these labeling claims influence whether the consumer believes these products are healthy or not? So we've got 3 questions here. Does it influence information search? Does it influence purchasing behavior? And does it influence health perceptions? Okay. And so to answer each of these 3 research questions, we again conducted a survey. So specifically, we recruited over 5,000 US adults using the Research Now online panel. And in that survey, we basically assigned the participants to a discrete choice experiment where they were asked 2 questions. Okay, so the first question that we asked them was we asked a choice question where they were asked to consider 2 bags of chips, and we wanted to know, between these 2 bags of chips, which product would you actually buy? Okay. And so as you can see, these chips differed based in terms of like type. So they could be veggie chips or potato chips, but they could also differ based off of the inclusion of a fortification labeling claim, like the one we have here. So we see the chip on the right is fortified with calcium or vitamin D. And so we just wanted to know, like, okay, between these two bags of chips, which one would you prefer to buy? Product A or product B? So that was our first question. Then our second question was which of these two products is healthier? And so they were again confronted with the same bags of chips. And now they were asked, which of these two products do you think is actually healthier? Would it be A or B? And so they could look, so if they wanted to, on this on the survey instrument, they could click either of these bags of chips and it would kind of rotate virtually to show them the nutrition facts panel on the back. And so here's what those nutrition facts panels look like. And so in the question of like, do they think it's healthier or not, they could click on the bag, take a look at the back and see like, okay, based off of the nutrition facts panel, which of these chips actually, has fewer calories, less sodium, etc. Right? And therefore make a decision as to which one is healthier or not. All right. And so here, so those are the two choice questions as part that were part of our discrete choice experiment. And again, here's just a summary of the experimental design that we used in our discrete choice experiment. And so this just shows the ways that these bags of chips could differ. So as I noted, they could differ based off of whether they include a fortification labeling claim or what we could call a nutrient content claim. They also could differ based off of the type of chip being shown, whether it's a veggie chip or a potato chip. And then lastly, they could vary based off of whether they were actually fortified or not. And they could vary based off of whether their nutrition facts panel, this here, was either healthier or less healthy. Okay. So those are the ways that the bags of chips could vary in the discrete choice experiment. So once the survey was completed, we could use the answers that respondents gave to each of these questions to try and address our three main research questions. So in particular, we used logistic regression analysis to answer each of the three research questions. So first off, we took a look at the likelihood that respondents would click on the nutrition facts panel whenever they were choosing a product in the first choice question, because this kind of helps us learn whether the presence of a fortification labeling claim influences the likelihood that consumers seek out this additional nutrition information. That was the first research question that we were tasked with answering. Then second, we could use we could use the answers the participants provided to the first choice question to determine, does the presence of a labeling claim influence the likelihood they would choose one product over another? So are they more likely to choose the product with a labeling claim and everything else being constant or not? And then lastly, we could use the answers to the second choice question to see, does the presence of a fortification labeling claim influence whether respondents believe the product is healthier or not, holding everything else constant. And so, like I said, we basically used each of those pieces of data and analyzed them using logistic regression to determine whether or not, or to answer each of these research questions. All right, and so that's what we did. So now let's take a look at the results of our statistical analysis. So for the first research question, again, we're just looking at the likelihood that the participants actually clicked on the product to see the nutrition facts panel or not. And so here's a summary of our results in terms of odds ratios. And so if the odds ratio is equal to 1, that basically means that regardless of whether the product featured a nutrient content claim, a fortification labeling claim or not, they were just as likely to click on the product to see the nutrition facts panel, regardless of whether the label was present or not. If the odds ratio is greater than 1, that means there was greater likelihood that they would click on the nutrition facts panel. And if it's less than 1, then that means they would be less likely to click on the product to see the nutrition facts panel. And so as we can see, the odds ratio was indeed below 1 and statistically significantly different from 1, indicating that the presence of the fortification labeling claim, or what we could also call the nutrient content claim, made participants less likely to click on the product to see the nutrition facts panel. Okay? So in other words, the answer to our first research question, does the presence of the nutrient content claim influence the likelihood participants seek this nutrition information? The answer is yes, it does. It makes them less likely to seek out additional nutrient information about the products that they're purchasing. So that's our first research question. Our second research question was to see, like, does the presence of a nutrient content claim influence the likelihood that consumers would actually purchase a product or not, holding all other things constant, right? Like holding chip type constant and healthiness of the product constant, etc. And so here we'll have 3 sets of results. So again, we're looking at odds ratios. So you would interpret this graph the exact same way as the previous one. So if the odds ratio is equal to 1, that means regardless of whether the product had a nutrient content claim or not, they were just as likely to purchase the product either way. If the odds ratio is greater than 1, that means including the fortification claim made them more likely to purchase the product. And if it's less than 1, that means that they were less likely to purchase the product. And so we have 3 sets of results here. So let's look at the bottom set. So this is the result for all participants. And as we can see, the odds ratio was greater than 1, right? So indicating that the presence of a nutrient content claim made consumers more likely to purchase the product, everything else being held constant, okay? But one interesting thing was we decided to look to see, does this differ based off of whether the respondent clicked on the product to see the nutrition facts panel or not? And so what we saw is that if respondents clicked on the nutrition facts panel, so in other words, they were interested in learning more about the healthfulness of these products, then in that case, the presence of a nutrient content claim now we can see that the confidence interval around this estimate now includes 1. So it is not statistically different from 1, meaning that for respondents that clicked on the product to see the nutrient facts panel, that they were no more likely to purchase the product regardless of whether it featured a nutrient content claim or not. It was only with the people who did not click on the product to see the nutrient facts panel that we do see that for them, including a nutrient content claim made them more likely to purchase that product, everything else being equal. Okay, so the presence of a nutrient content claim made participants, at least participants that did not click on the product to see the nutrition facts panel, more likely to purchase the product. So the answer to our question, does including a fortification labeling claim influence the likelihood that consumers will purchase a product? The answer is yes, it does. It makes them more likely to purchase a product, especially if whenever we're looking at consumers that did not click on the product to see the nutrient facts panel. All right. And so that brings us to our final set of results, which is where we're looking at our third research question. And we're wanting to know, does the presence of this nutrient content claim influence the likelihood that participants will choose one product as being healthier than another product? And so again, we have we're again presenting our results in terms of odds ratios. And so you can interpret this graph exactly the same way as the ones before, so I won't step through it again. And just like before, we now have 3 sets of results. So let's look at the results for all participants. So looking at all participants, it does look like including a nutrient content claim makes participants more likely to believe the snack food was healthier, holding all other factors constant, right? And we can see that that's actually true not just for the participants who did not click on the product to see the nutrient fact panel. It also was the case for people who even clicked on the nutrient fact panel. So, like, regardless of whether you looked at the nutrition facts panel or not, you were more likely to believe a product that said that it was fortified with vitamin D or whatever is more healthy just because it's fortified. So the answer to our final research question was, does including a nutrient content claim change consumer health perceptions? The answer is yes. Including content claims like these makes consumers believe the product is more healthy even whenever it isn't. And so therefore, including these nutrient content claims, at least as we argued in the paper, has the potential to potentially mislead consumers, right? Because it potentially has the potential to mislead them into believing some products are healthier than they actually are. Okay, and so that was sort of, what we were thinking of whenever we wrote the article. All right. So I believe that that is the end of our presentation. So I believe that brings us now to the point where we can answer some questions.